Hey guys, we're going to talk about acupuncture and the Florida Administrative Code for that. Acupuncture is defined as a modality of diagnosing and treating disease, pain, or physical conditions by stimulating various points on or within the body or interruption of the cutaneous integrity by needle insertion to secure a reflex relief of the symptoms by nerve stimulation. We're going to have a test on that at the end of this video, so I hope you heard that. Acupuncture, I'm joking, is recognized as a modality of treatment which is an adjunct to chiropractic, it's related to, presently taught as part of the curriculum in approved chiropractic colleges. The proper administration of acupuncture requires a thorough knowledge of physiology, anatomy, therapeutics, and diagnostic acumen. So there's some limitations on what chiropractors are allowed to do to treat with acupuncture. So the limitations are, chiropractors are expressly prohibited from using the modality of acupuncture to treat any of the following diseases or conditions, okay? So you're allowed to treat these people. We had another video similar. You can't say that I am going to treat or cure your cancer, leukemia, tuberculosis, syphilis, gonorrhea. I wonder where those needles get placed. Syphilis, gonorrhea, hepatitis, anthrax, diphtheria, Hansen's disease, Hookworm's disease, malaria, rabies, typhoid fever, typhus fever, and AIDS. You can treat people that have those conditions, right? That would be really shitty, discriminatory to do. But you can not tell them I'm going to treat that disease, all right? You can treat the symptoms of disease, like we talked about it before. If somebody has vertigo from the medicine they're taking from cancer, you could treat their vertigo. You just can't say I'm going to treat your cancer, all right? Authorized procedures. This just talks about the needles, but where non-disposable needles are used, the needles must be sterilized only by generally accepted procedures to sterilize needles. Kind of vague. Needles shall be individually packaged for each patient. The individually packaged needles shall either be destroyed following patient dismissal or put in a permanent file for the further use of the patient where non-disposable needles are used. Only non-corrosive needles shall be authorized and used. That would suck if you're using corrosive needles, I guess, huh? Generally acceptable cleansing agents shall be used for cleansing the needles. Prior to any licensed chiropractic physician engaging in acupuncture, that physician shall complete a minimal educational background of 100 hours of study in the practice of acupuncture, with the courses and seminars being approved by this board. Prior to engaging in the practice of acupuncture, the physician must be required to present certification to the board after completing that course. So it's a 100-hour course, 100-hour study that you have to do. It's got to be approved by the board. Make sure you do one that's approved by the board before you do it. And again, just to go over it one more time, acupuncture is a modality of diagnosing and treating disease, pain, or physical conditions by stimulating various points on or within the body or interruption of the cutaneous integrity by needle insertion to secure a reflex relief of the symptoms by nerve stimulation. Thank you guys for joining.